Okay, so our presentation is on sensory and autonomic ganglia and just a few of the differences and similarities between them. So first of all, we thought we'd cover what is a ganglion. And basically, it's a collection of nerve cell bodies, which is usually located in the peripheral nervous system, and it includes the supporting cells, so cells like satellite cells. Ganglia provide the relay points and intermediate connections between different neurological structures in the body, so between the peripheral and central nervous system, for example. And they are usually the site of neuron synapsing. You can basically classify them in different ways, but for our presentation we've chose to put them into three main subgroups: dorsal root, cranial nerve, and autonomic ganglia. So dorsal root ganglion contain nerve cell bodies in the posterior root of the spinal nerve, and these are sensory ganglia. They carry information from the body to the central nervous system. Cranial nerve ganglia contain both sensory and autonomic fibers, so they can be either sensory or autonomic ganglia. It's a bit more confusing. And then autonomic ganglia are clusters of nerve cell bodies in the autonomic nervous system, and they can be further divided into the sympathetic and parasympathetic ganglion. And we're just going to cover each of these in a bit more detail now throughout the rest of our presentation. So first of all, we have dorsal root ganglion. These are, or spinal nerve ganglion as they're also known. These are the ganglion which contain cell bodies of sensory neurons, and they contain afferent fibers which carry information from receptors in the tissues, muscles, and organs, and carry them to the dorsal horn of the spinal cord. As the action potential moves down the dorsal root ganglion, it goes from the distal to the proximal process, and it actually bypasses the cell body. So it kind of goes from there down there and misses this bit out. And the action potential itself is initiated in the distal process, which can either be a bare nerve ending, or it can also be encapsulated to help relay specific information. So this is the case if you have a proscenium corpuscle, for example, which is sensitive to pressure or vibration. Dorsal root ganglion are known as pseudo-unipolar. This means that they have two branches which act as a single axon. And they're also surrounded by satellite cells and supportive cells which form a prominent capsule on them. So we're going to move on to the autonomic ganglia. And first we're going to cover the sympathetic ganglion. Now, the sympathetic branch of the autonomic nervous system has thoracolumbar outflow, and it originates from the T1 to the L2 region. The fibers that go from the central nervous system to the ganglion are known as the preganglionic, and those which go from the ganglion to the effector organs are known as the postganglionic fibers. In the sympathetic system, the preganglionic are the shorter and the postganglionic are the longer fibers, and this leads to the ganglion forming the paravertebral ganglion chain or sympathetic trunk. However, you do also get other ganglia in the sympathetic nervous system which are located between this trunk and the effector organs, and these are known as prevertebral or collateral ganglion. So when a nerve fiber reaches the paravertebral ganglion chain, I have four options as to what it can do. It can either synapse at the level that it enters, it can move up the chain and synapse, move down the chain and synapse, or it can pass through the chain and synapse elsewhere, and you can kind of see that on these ones where it's passing through the chain and then synapsing later on. And this happens in the spinal nerves, and there's a specific example where in the case of the adrenal medulla it actually synapses at the organ itself, which acts as its own specialized ganglion.
Alright, so I'll talk about the parasympathetic nervous system. So the parasympathetic nervous system has a craniosacral outflow. So the outflow is from cranial nerves 3, 7, 9, and 10, and sacral levels to S2 to S4. Parasympathetic nerves, they don't have their own discrete ganglia, so they synapse instead within or near the walls of the organs which they innervate. There's an exception to this, and this is the parasympathetic nervous system of the head and neck, which will be on the next slide. Talking about the differences between the autonomic ganglia as a whole and dorsal root ganglia. The satellite cells, which are a type of glial cells, in the autonomic ganglia are more sparse and they're less apparent. So these are the 4 discrete ganglia in the head and neck. These are associated with the parasympathetic divisions of some of the cranial nerves. So the oculomotor nerve, which is cranial nerve 3, synapses at the ciliary ganglion. The facial nerve, the parasympathetic division of the facial nerve, branches into 2, and one of them synapses at the pterygopalatine ganglion, and the other at the submandibular ganglion. The glossopharyngeal nerve, it synapses at the otic ganglion. The vagus nerve, which is also a cranial nerve, cranial nerve 10, it does not have its own discrete ganglion, so it acts like the rest of the parasympathetic nerves, and it synapses on the walls of the organs which it innervates. Talking about the sympathetic supply to the head and neck, the outflow is still thoracolumbar, so there must be a way for the sympathetic fibers to reach the structures of the head and neck. So the preganglionic fibers, they travel up the prevertebral chain, and they synapse in any one of these 3 cervical ganglia. The superior cervical ganglion is located anterior to the vertebral levels C1 to C4. Middle cervical ganglion is located anterior to the vertebral level C6, and the inferior cervical ganglion anterior to C7. And these are part of the paravertebral chain, which is also known as the sympathetic trunk. So after having synapsed at any one of these ganglia, the postganglionic neuron, it hitchhikes onto the carotid arteries and reaches its target from there. Lastly, we have some sensory ganglia as well. So these are associated with the sensory branches of some of the cranial nerves. So we have the trigeminal ganglion, which and fibers emerging from the trigeminal ganglion form the sensory branch of the trigeminal nerve. We have the spiral or the cochlear ganglion, so fibers from this form the sensory branch of the cochlear nerve. The vestibular ganglion, which forms the vestibular nerve, and the geniculate ganglion, which forms the facial nerve. And structurally, the sensory ganglia are very much similar to the dorsal root ganglia as well. And that's all. Thanks.